Welcome back, everyone. It's 9:45. I hope you had a nice break. We're ready for Dr. Tharpe's next talk, Management of Unilateral Hearing Loss in Children, an Updated Conceptual Framework.
Great, thank you. Nice to be back. And I was just telling Dr. C, as much as I appreciate remote conferences like this, I would have just really liked to have been able to go out in the hallway and have a cup of tea with people and talk about some of this, because it's also fun to sit and talk about these ideas. So please, please ask your questions at the end, because that's the best part, I think. I hope you agree. So now, as I said earlier, is the time that I'd like to talk with you more about the management and how I'm thinking about the management. And I know we'll be having additional speakers this afternoon on this topic, so I hope I'm not overlapping. So so here's my last Yogi Bearism for the day. When you come to a fork in the road, take it. So the reason I put that up is that, I've shared with you the way that we can garner additional information that we didn't have 40 years ago when I started this work. That through the electronic medical record, we have access to so much more information. But it's not just the electronic medical record. We have a lot more tools than we had back in the day. And so we need to take advantage of all of those tools. And we'll talk a little bit about that. But the way that I think about management, as I alluded to in the first presentation, is that we really need to take a personalized hearing healthcare approach. It's not one size fits all any longer. There are a lot of tools at our disposal now that we can use, and so I will talk with you about some of those things. Someone asked me about listening effort and fatigue. And that's one of those things that we have learned about over the last couple of decades. And so I think it's relevant for us to consider this information as we think about the management of children with unilateral hearing loss. So do children with unilateral hearing loss have listening difficulties that result in effort and fatigue problems? Well, way back early on, when we were looking at children with minimal sensorineural hearing loss, we used something called the co-op scales to get an idea about the functional health of children with unilateral as well as other forms of minimal hearing loss. And we found that children with minimal hearing loss reported less energy than children with normal hearing. So that's kind of the background, the basis, the motivation for additional work in this area. So first, let's think about what is listening effort. So listening effort is when we allocate our attention and our resources to auditory tasks. And think about how we all do that. That is a natural event, if you will, for all of us. If we, for example, are talking with someone who is not a native speaker of English, for example, maybe we are overseas, or maybe that individual is here and we're not used to the dialect, even though we know the language, it's harder to understand, and we have to listen much more carefully. Another example I always like to use is it's sort of listening effort, but it's if you're driving in a storm and it's the rain is pouring down, you're thinking, oh, this is hard. What do? I turn off the radio. I don't know if other people do that, but one might say, why are you turning off the radio? Because I need to focus elsewhere. And that's exactly what we're talking about when we talk about listening effort. And then fatigue is a little bit different. Fatigue is the result of that listening effort. There's not a standard definition. It can be physical fatigue, mental fatigue. It might just be that you say, I feel fatigued, and you can't actually define it very well. But some colleagues of mine, Hornsby and others at Vanderbilt, have done a good amount of work in this area. So there's growing evidence that children with unilateral hearing loss are exhibiting listening effort and fatigue. An early study that I did with one of my PhD students, Candace Borland, demonstrated well, let me back up and tell you what we were doing. We had children listening to speech in noise. And so we've talked about that already, that the more noise you have, the more difficult the task should be relative to just listening in quiet. And while they were listening, these were school-age children, while they were listening to the speech and having to repeat back the word that they heard, they were also asked to do something else. They were asked to push a button that lighted up. So randomly, the light would come on and the child had to push the button. And we measured how long it took them to push that button. What was their reaction time? And as you can see on this graph, the children with the hearing loss are represented by the blue bars, and normal hearing children are represented by the gold bars. Their reaction times for the children with the hearing loss were longer across all listening conditions than children with normal hearing. So think about that a little bit. That what is it that's slowing them down? And our assumption, of course, is the listening effort that is required of them. It slows down what we refer to as their secondary tasks, the other things that we're asking them to do. I will say, just in case you think, well, maybe the children with unilateral hearing loss just happen to be slower on a reaction time task, no matter what. But there was no difference when we asked them to just push a button and not listen to the words. So we know that there was nothing different about their ability to do that, but they were slower when they had to listen. So what does this mean about children in the real world? Well, it depends, doesn't it? We can't say it's the same for everybody because we know it depends on the classroom acoustics, for example. We've talked about how that can impact. Well, some classrooms are louder than others. Some are really acoustically sound and not as much of a problem. It depends on the cognition of the child. Is the child just better able to pick out what they want to hear from the background? Maybe that's a skill, a cognitive skill that they have that not every child has. And are they able to pay better attention? Maybe some children don't get as distracted with all of the noise as other children do. So what is the effect of hearing loss on subjective reports of fatigue in school-age children? In other words, what do children themselves say about whether or not they are fatigued? And we'll talk about that in regards to a study that Hornsby and colleagues conducted. But I think it's important to note what the consequences are of continuing ongoing fatigue, because it can lead to inattention, poor concentration, distractibility, etc. And what does this sound like? This sounds like what I talked with you about in my first presentation about what the teachers reported for these children in the classroom. And we know that different kinds of fatigue can lead to this. So what they did and what Hornsby and his colleagues did for this study is he took 10 children with hearing loss, and these were different levels of hearing. So this is not a study just of unilateral, so I want to make that clear. And then he age matched them with children who had normal hearing. And he used a tool called the PEDS QL. It's the PEDS Quality of Life Fatigue Scale. All of these children had normal nonverbal intelligence, but they did have differing language levels. And this is what they found. So if you're looking at these bars, the lower the bar, the more fatigue the child reported. So as you can see here, the children with hearing loss, represented by the red bars, reported significantly more fatigue than their normal hearing counterparts. And what's especially surprising to all of us is that the fatigue scores that these children reported were greater than those reported by children who have cancer, rheumatoid arthritis, diabetes, and obesity. That's really shocking, isn't it? I'm giving you a second to just kind of think about that. Now, again, this isn't children with unilateral loss. This is children with hearing loss, and they range in degree. But it's interesting to note this, and we will be talking about unilateral hearing loss and fatigue more specifically. But these were the motivators for this set of studies. And here you see, and this is why I think this is relevant for a conference even with unilateral hearing loss, is that there was no association. And for those of you who aren't familiar with looking at graphs like this, showing correlations and that kind of thing, the point is, if you look at all these dots, they don't seem to be related to anything. They just seem to be randomly out there, and that's exactly right. That there was no association between the fatigue ratings that these children reported and their degree of hearing loss. And I think that's fascinating. Why is that? So I think all of us should think about that a little bit. But even though that was the case, if you looked only at the cognitive fatigue ratings, they were associated with language ability. And they used a test called the SELF to report that. And there was a correlation there. They were associated. Now, why is that? Well, I would presume that having higher language abilities allows us to discern what speech signal is being presented based on our higher language score. In other words, we refer to that as closure ability. So if, for example, as an adult with normal language, there was noise in my house, but I heard my husband say something like, "Where are my ooh?" I would immediately consider the context and think, I think he just said, where are my boots? Right? So if I could miss a little bit of the signal and I could still understand what was happening. And that way I'm not having to pay quite as much attention and exert that kind of effort, because my language ability takes over for that. So that's why I think it makes perfect sense that the fatigue ratings were associated with the language ability. So this group of researchers developed a pediatric version. There's an adult version, but they've more recently developed a pediatric version of the Vanderbilt Fatigue Scale for children with hearing loss. And this is a valid and reliable tool that you can use to try to determine for the patient sitting in front of you whether there is concern about fatigue for this particular child. And that's part of what I mean by taking a more personalized approach to hearing healthcare. So if I have a child in front of me who demonstrates on a tool like this that's valid and sensitive that they have a high level of fatigue in a classroom setting or even in a home setting, whatever, then I immediately start thinking, okay, what kind of hearing technologies might be helpful for this child? We're starting to put little pieces of the puzzle together to help us know. And this was a question that was posed after the last session, to help us know, when do we provide some of this hearing technology? Do we have to give it to everybody? So this is another study using the fatigue scale that demonstrates. So if you look at this, these graphs, so you've got the white bars that represent individuals with no hearing loss. The black bars are those with bilateral or hearing loss in both ears. And then the striped bars are or gray, are those with unilateral loss. So you can see here that adults who have unilateral hearing loss rate listening fatigue similarly to if they have unilateral loss, similarly to those individuals who have bilateral hearing loss. And then if you look at what parents say about their children who have unilateral loss, more parents reported that their children with unilateral loss had fatigue than did parents of children with bilateral loss. That might be indirect evidence that because children with bilateral loss are more likely to use hearing technology than those with unilateral, that there is that relationship or that downstream benefit to fatigue if hearing technology is used. And so more and more of those studies are coming out with bits of that conclusion. And then when we asked, what about children with unilateral hearing loss? How do they subjectively rate their own fatigue? You can see that not quite as much as children with bilateral, but up there, a considerable amount, much more fatigue than children who had no hearing loss. So again, another piece of the puzzle that I think is important for us to consider. So the conclusion is that children, whether they are aided or unaided, will report significantly more subjective fatigue than children with normal hearing. And that's been backed up by this work by Backham just a couple of years ago. If you're interested in seeing the Vanderbilt Fatigue Scale for children, this is the link. It is available and it's free. This is available now in, I don't know how many languages, in languages that I didn't even know what they were. There's so many languages right now. So I hope that's helpful. And they are still translating this. And so if you need it in a language that's not on this website, reach out to Dr. Ben Hornsby. His email is there, and you can request to work with him in trying to get the translation that you need. So, are children with unilateral hearing loss at risk for listening effort and fatigue? Yes. The data are there and they are strong. And I just throw this in so everybody can get a little chuckle because I think it's funny. So the question is, what do we do about it? Certainly, the hearing technology that we're going to talk about is one approach to ameliorating the effects of fatigue. But I really like this study as well, where they looked at a large group, almost 4,000 elementary school children and older children. I mean, they're 10 to 12 years of age, and found that if they provided them with a nap in the middle of the school day, there were very positive outcomes as a result of that. Now, we might be sitting there thinking, well, yeah, but we don't run schools. We can't have naps provided. But wouldn't it be great if that was something that we could write into an IEP or an IFSP, that your child needs this nap for 30 minutes? I don't know. Your child might not be willing to do it either, but something to think about. So, do hearing technologies mitigate academic risks? I think that's, as I said, when we were doing the question and answer after the first session. I think it's still a bit unknown, but let's think through it a little bit. So, if you look at this picture of a classroom, this is much more typical of classrooms today than the kind of classroom that I attended, 100 years ago, when we were sitting in rows and we were all quiet at our desk and facing the teacher. Our classrooms today are much more dynamic in general. And certainly, for example, the woman who, I think it was a woman, yes, who asked a question after the last session about her 4-year-old in a daycare setting, I'm sure is a very dynamic and active environment. So you see here that there are children working in small groups. They need to hear not only the teacher, but also the children sitting next to them. What do we do in that situation? What is the best technology? Because not only is the classroom dynamic, but look at the school as a whole. They're not only just in the classroom. So we shouldn't just be worrying about how a child is hearing in the classroom setting, but maybe out on a sports field or in these noisy hallways, in the gymnasium, in a break room where maybe they have their lunch now. So there are a lot of things that we have to think about when we're trying to consider what kind of technology does a child need to use. We know that there's noise, no question, throughout the school. And we know that the noise levels that are in classrooms almost always exceed the recommended noise levels that are published by the ANSI standards. And that noise tends to surround children. Again, it's not just that, children can't stay in a preferential listening position throughout the day. They're going to have noise coming from all over the place. The other thing, so I want to mention we have different kinds of unilateral hearing loss that we need to think about. And that was something that I introduced early on. Unilateral hearing loss is not just one thing. It could be a mild high frequency loss. It could be a profound loss. But if we're talking about unaidable hearing, and this gets back to what I was referring to as LUHU, the way that I define an unaidable hearing in an ear is that the loss is profound. There is very poor word recognition, and there's an intolerance for amplified sounds. In other words, a hearing aid can make the sound going into the microphone is really, really loud. we cut it off at a given level because we know that individuals will not tolerate that level of sound. So any of these three things could result in a hearing loss that I would consider unaidable. And so what do we do when that's the circumstance? Well, in terms of, I know someone else is going to talk about surgical options, and someone else is, I believe, is going to talk about bone conduction, transcranial devices. But here I want to just talk about remote microphone system use and contralateral routing of signals or cross hearing aids. For those of you who might be unfamiliar, just very quickly, remote microphone is that you typically in a classroom anyway, the teacher is wearing the microphone, or the desired speaker is wearing the microphone, and then the child is wearing a personal device on his or her ears to pick up that signal. So it just improves it. It helps overcome the impact of distance, the impact of noise, and to a lesser degree, but a little bit of reverberation, or the bouncing of the sound throughout the classroom. With a contralateral routing of signal or a cross hearing aid, then if this is the poorer ear, there's a microphone set on that side, looks like a little hearing aid, and it transfers the sound over to the normal hearing ear. So I'm going to talk with you about these two situations. So I credit my colleague Erin Paku for these lovely cartoon illustrations to help us talk through this. So in this situation, we have this happy little girl who has a profound hearing loss, unaidable hearing, I should say, on her right ear. She has normal hearing in her left ear, and her little friend is talking to her, and she can hear her little friend just fine because she's on the side of her normal hearing ear. But she doesn't hear the teacher very well because the teacher's back is to her. She's a little further away. So now our little girl is still in the same spot, but she's using a remote microphone system. And the teacher is using the microphone. So she can still hear the little girl clearly because nothing's changed there. But now she can also hear the teacher clearly. In this situation, she is using the cross hearing aid. And again, remember that's what is happening in this situation is that sound from her right ear is going across, getting picked up over here by her good ear. She can still hear her friend, but not quite as well. And why is that? Because she's picking up the sound of these crazy little boys who are causing trouble back here, and it's going over to her better hearing ear. And of course, it doesn't help her at all in hearing the teacher. Now, in this situation, let's think about not how she is listening to her little girlfriend here, but how she's listening to this little boy off her poorer hearing ear. And he's saying, do you want to have, what does he say? Oh, do you want to sit with me at lunch? And she can't hear him at all because he's on her poorer side. She can still hear her teacher somewhat, but not as well because she's not using any technology. Now she's using the remote microphone system. So in terms of listening to this little boy, the remote microphone system is not helping her hear him because there's no mic over there. She can still hear the teacher. So she misses out on a lunch date with that crazy little boy. Now she's using a cross hearing aid. She can hear this little boy invite her to lunch quite clearly, but cannot hear the teacher. So what do we make of all of that? Because you're probably, if you haven't thought about it much as I have or some of us have, you're probably a little confused. Well, the lesson here is that the cross hearing aid has the potential to help some children under certain conditions. But it has to be used carefully. One has to think about what is the organization of the room, where is the desired signal, who is the speaker that we're trying to listen to. Are you just sitting at a small round table so that you want to be able to hear who's sitting on your poorer side? Then a cross hearing aid might serve you very well, because you can hear things coming from your better side if it's in a small group setting. So that's when it can work. But the benefits of the benefits of the cross hearing aid are typically during times when you want to hear other speakers who do not have a remote mic available. So there are manufacturers who are working on trying to do a better job of integrating cross hearing aids and remote microphone systems so one can have the best of both worlds. In the meantime, it is very important to learn what situations is a child in, when are they having trouble, what are they having trouble hearing. In other words, once again, we need to personalize what's going on. So in an attempt to personalize and understand what's going on in school environments, we attempted to develop a questionnaire for students, and we based it on a questionnaire that Todd Ricketts had developed for directional microphone use. Excuse me. So we changed up the questionnaire so that it would be appropriate for children with unilateral hearing loss to report when they're having difficulty. So we took this questionnaire that Ricketts had designed and updated it. And it's a picture book questionnaire, if you will, where we were able to ask children to pretend like they don't have any hearing devices, no hearing technology. You're just listening without any technology, just with your natural hearing. And they were asked to rate the pictures, just the communication pictures described as being very easy, a little easy, down to very hard, or it does not apply. And here's an example of what the picture would look like. So you see that they're sitting in a cafeteria, school-based cafeteria. This girl is marked as me, so they know, okay, what perspective am I supposed to be taking? And this girl is marked as friend. So she's in a noisy setting, but she's trying to talk with someone directly in front of her. So this is the ranking system that was used. And then we had 3 subscales, and this is the what's called the front subscale. And the questions were, I am eating lunch at school. My friend across the table is telling a story. Or I am in a classroom in the front. The teacher in the front is telling the class what to do, etc. These are the examples. There was also a behind subscale. So for example, I am listening to the teacher in class and classmates start talking quietly behind me. I want to know what they're saying. So I really love that one, because we know that students aren't always wanting to listen to the teacher. Sometimes they want to hear what their friends are saying behind them. And so it's important for us to recognize that children need some independence in terms of what they want to hear and what they don't want to hear. Another example is I am in a quiet room talking to my friend who is talking behind me. So there's a range of situations for the behind subscale. And then thirdly, there's the localization subscale. For example, I am in a noisy gym and I hear someone say my name. I want to find where they are. Or I am on a sidewalk at a busy intersection. I am trying to listen for traffic coming from all directions to know when is the best time to cross the street. So here's some examples. I've shown you this first one already, but here's an example from the behind subscale. I am in a quiet room talking to my friend who is studying behind me. Again, the pictures are clearly marked as to where the respondent to this questionnaire needs to imagine she is. And then localize, I am hanging out with my friends. Someone's phone starts to ring and I want to figure out where the ringing is coming from. And it shows this is where you are. This is the orientation of the friends. So the V-class was validated. We distributed the survey through Hands and Voices. And so I thank Hands and Voices for distributing this for us. We ended up with 1,800 completed questionnaires. And these were the self-reported degrees of hearing loss of the respondents. So some noted that they only had a little hearing loss and some had more significant to total hearing loss. So we got the data on all of these children. But in this case, what I'm going to share with you is not all of the data, but the data that are relevant to unilateral hearing loss, given the topic of this conference. So first, if we look at those responses from children who were normal hearing, so we included the control group of those with normal hearing, they found that all the listening conditions were very easy. So they scored them that way. If you look at those that have a little, some, or significant or total unilateral hearing loss, you'll see there's not a huge amount of difference, maybe a bit of a difference between those with little unilateral loss and those with total unilateral loss. But what is consistent across all of these subscales is right here, is that when they were completing the FAR subscale, there, and there, they all reported closer to, or they reported more difficulty with trying to listen when the noise of interest was far away. That was the consistent piece of that. We do a lot of, and I think this is important for this reason. As audiologists, we evaluate the listening of children in noise quite a bit. We are really focused. If we're not focused on the audiogram, then we get focused on how do they hear in noise and how are we going to improve their listening in noise. I don't think we think enough about the distance factor that is also very important for children with hearing loss to hear. And apparently that's where they have more difficulty than anywhere else, is when they're listening at a distance. So let me share with you now the version that is aided. So it's basically very close to, almost identical to the unaided version. We then ask them, report on when you are using your hearing technology. Same instructions. So I'm not going to go over those again, but this time they're pretending they are wearing their hearing devices. We had 897, almost 900 responses for this particular survey because some of the children with unilateral hearing loss did not use technologies. And you can see here the technologies that were reported. So just a standard hearing aid. Most of them used a traditional air conduction hearing aid. There were some with contralateral routing of signal or bone conduction, some or routing of signal hearing aids, some with bone conduction, and some with cochlear implant. And we can see here that the results across the board were fairly similar. There's some differences here or there, but they're fairly similar across the device used. And they reported in general that listening was fairly easy overall. But it was still the case that distance, or that far condition, was the one that was most difficult. And you can see that by this little drop here, 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 and here. So how do hearing technologies help students in today's modern classrooms? Because they are diverse, complex listening conditions. In real classrooms, hearing technology is beneficial for children with unilateral and bilateral hearing loss. And self-report measures from the classroom can personalize this care that we're providing. So again, we don't have to do the same thing for every child. And I want to note that in addition to the tools that I've shared with you today, the V-class and the Vanderbilt fatigue scale, there is, I think, a nice consensus practice parameter that we put together. This is focused on the audiologic management, but it includes other things, and I'll show you that. But if you haven't seen this, I think it's a nice overview of the kinds of things we should consider in our management of children with unilateral hearing loss. We pulled together a group of what we consider experts on unilateral hearing loss, including a parent representative. And we covered the identification and audiologic assessment and monitoring for these children, medical management, technology management, information counseling for families, and our priorities for research. We came up with a flow chart that you can't read, but let me pop some of this out for you. Part of what we are interested in knowing about children who come into our clinics is, do we know what the etiology is? Do we know what caused the hearing loss? Because that can tell us some things about whether the hearing loss is likely to progress, whether the hearing loss is likely to become bilateral rather than unilateral. Are there vestibular or balance concerns? And so there are questionnaires about balance concerns that can be given, or one can just question parents about whether they're concerned about their child's balance, because children with unilateral loss are at higher risk for balance disorders. Are there hearing, learning, or speech and language concerns? And then there's a number of different tools that are listed in this document that you can use to find out that information concisely. And then we talk about the various hearing aid or hearing technologies that are available and what the advantages and disadvantages are. Now, when we're thinking specifically about which device to use, so a lot of what I talked to you about was, is a device needed? And some of it can help guide what kind of device is needed, depending on the situation, the classroom listening, and that kind of thing. So the first question that needs to be asked, if a decision about amplification has been made, is what's the degree of hearing loss? Is it an aidable unilateral loss? Is there a history of ear infections or otitis media with effusion that can be causing that conductive component that we talked about in the last session? Where is the child doing this listening? Are they in daycare? Are they in school? Are they at home? How can we enhance their listening, and how does that influence what kind of technology we want to use? We, of course, need to consider the family factors. Are families ready for technology for their child? Are they motivated and accept that their child is having difficulty and needs some additional care? Many families, as we've kind of alluded to, just like teachers and audiologists and others may not feel that a unilateral hearing loss or a hearing loss in just one ear is something that really is going to require technology. So there's still that mentality of perhaps they can get by. So I think that these tools that I've been talking about can help in terms of trying to identify whether this child is getting by the way that we want them to. And then there are child factors that need to be considered. What's the developmental status of this child? How is their speech and language? How are their academics, their behavior, fatigue? All of those factors, we've talked about how to get that information, are going to feed into what type of hearing technology we might want to use. So thank you. I hope I've answered some of the questions that you had from the prior session. And if not, then we have time for more questions now.
Thank you. Well, people are submitting their questions. I'll invite the panelists if the panelists have any questions. Also, I don't want to hog the opportunity to ask questions, but I'll kick off with a couple. Some of the earlier studies you showed from, I think, Dr. Bess with the kids with bilateral hearing loss and fatigue and those things, were those in the aided situation or the unaided? Did you distinguish that, and do the scales, do you administer, and then kind of on a related note, when you administer the scales, are you asking the kids to report kind of in the unaided and the aided?
Right. No, great questions. Thank you. So your first question about the minimal hearing loss data that Dr. Bess shared and collected. Those children, interestingly, because that was all children with minimal loss, most of those children had not been identified with loss. And let me explain. So one of the criticisms of our first study, and I think it was justified, when we came up and said, 50% of the children we tested were having academic difficulties, they said, well, yes, but it was a self-selected group because you were taking children whose parents had brought them to your center because they were concerned. And so, you had a biased sample there, and they're absolutely right. I mean, that no question about it. So the study that I presented from Bess later on, he had taken a van that I think the Lions Club had given us out to screen hearing at schools in rural Tennessee. So we had an otologist, an audiologist, we had, we did everything. We did otoscopy, we did full evaluations and all of that. And we found a large percentage of children with minimal degrees of hearing loss, including unilateral loss. And those children with minimal hearing loss in both ears, the majority of them had not been previously identified. So to answer your question about were they amplified or were they using technology? No, because so many people didn't even know that they had a hearing loss. Now, for the children with unilateral, if it was of any significant degree, the children would know they had a unilateral loss, but they were not using technology. So this was pretty early on when our results were just first getting out there, and kids were not being aided or using technology. And oh yes, your second question was about using the questionnaires, and yes, so the questionnaire that we have on technology use and how it's helping them, we do it. We have them complete it as if they're not using any technology, and then complete it if they are. So it's kind of a think about when you do not have your technology on, then answer if this would be difficult.
Got it.
It's very subjective, right? We're not able, we didn't go out and test their listening.
Yes, yes.
They had to just remember and think back.
Great. Well, the questions are coming in. Thank you for the information. Is there a fatigue scale for patients younger than 6 years old?
No, but it's my understanding that Dr. Hornsby is working on something younger. So I don't know where he stands. He is spending a lot of time in the very careful translation of these tools, and so he's been really busy with that. But I'm assuming that there is interest for children under 6, and that's kind of the next step.
That's great that the scales are translated. It's quite a process actually to do that. It's like 2 steps forward, 1 step backward, or the other way around, but it is a process, and then you have to validate with the population, et cetera. So I can imagine, it sounds simple, but it is, I know it's not simple. So
it's not.
The next question, what are you recommending for infants with LUHU? Less than usable hearing. Yeah, I think that's less than usable hearing unilaterally. So close monitoring of hearing and speech language until school age versus BAHA use?
So it's a good question. There's always been a question about infants. What are you doing about infants? So look, and I could be wrong, so I'm just saying this is just my thinking about this over time. I feel that infants are generally listening in a pretty good signal to noise ratio up until they're at least 6 months. Now, could I be wrong? There are plenty of babies that are in daycare before that, and then it can be noisy. But if babies are at home with their parent and the parents are well educated, it is very difficult for infants to wear technology kind of on one side like that and explain to parents. So I'm kind of okay with it up until about 6 months, as long as a parent is with their child, is well educated about the need for good signal to noise ratio, and is holding them closely, whether that's on the back or on the chest or however they're communicating. I do think that children who are in daycare, and I have recommended this for some parents who are willing to do it, I think it's not a bad idea to have a remote microphone system in the bassinet with the babies, so that there's a little speaker on the side of the crib or the bassinet, and the primary caregiver is wearing the microphone. In this case, in a preschool situation or a daycare situation, that means the teacher or the daycare worker. But I've only done it when we have optimal conditions. In other words, the daycare worker was well trained, knew exactly when to turn it off and when to turn it on, because the daycare workers are moving all over. It's just very difficult. So, and also have considered sound field placements. I'm going to let the experts you're going to be hearing from later talk about the BAHA use and bone conducted use, because I know they're going to cover that topic completely.
They will go into that. Besides hearing technology and adjusting class schedules for secondary students, what accommodations would you recommend for unilateral hearing students with unilateral hearing loss reporting fatigue?
That's a good question, because, kind of following up on the question that I was asked earlier, I'm not confident that the use of technology is going to decrease the fatigue. But it still remains the first thing. And I know you're asking for things other than the hearing technology and adjusting class schedules. I think that anytime we can improve the acoustics in which individual secondary students are listening, then it's going to help with that fatigue. And being on top of their language skills. So I do recommend that children not just get diagnosed early on with unilateral loss, not only get monitored by their audiologist, but receive speech and language screenings early on. So if they do demonstrate difficulties, that we can be on top of that, because we saw that keeping language skills high is going to improve their fatigue. I hope that's helpful.
I thought the notion of a midday nap sounded very appealing.
So too.
So, do kids with profound unilateral hearing loss utilize both alternate contralateral routing of signal and RM in the classroom? And what does that look like?
So I am aware of some children who use a cross hearing aid, and then in the classroom they have a sound field remote mic system. There are, as I was saying, there's some development of systems that will integrate across and remote system such that they don't have to, they can automatically hear some signal from around if it's identified as clear speech. But those things they're still in the works. But I have seen sound field remote mic with a cross.
And I think maybe I'll ask Janet and Lisa to keep that question for one of the next Q&As also, because it'll be interesting to get different perspectives on that. You know, as you can tell, I don't think there are right or wrong answers in this to a lot of these questions, and a lot of it is, as Dr. Tharpe says, probably should be individualized to the child or student or patient, however you want to call them. But does early hearing technology intervention aid in greater success for academics and overall social and cognitive development? That's the million-dollar question.
That's the million-dollar question. We honestly don't know. But let me say this. We do know, without a doubt, that technology can improve listening for children with unilateral hearing loss. We do know that. It's that next leap into, does it result in improved academics? Does it ameliorate the difficulties they have in academics? We have not made that leap, but it's certainly worthy to ensure that children are able to hear well in a classroom setting, and make that easier for them. And so that's where we are.
I'll just, if no other question, oh, there's another question. Is there any research being conducted in partnership with educational audiologists in large school districts to gain more real-world insight and obtain more data points?
Yes, I don't know that I've seen any published, quite frankly. But I know that, for example, I know that the research arm of Phonak, one of the companies that makes this technology, the American arm is based out of Chicago, and they do look at placing technology in the school systems around Chicago. But I just can't tell you much more than that other than I know that they are doing that research.
I'll close the Q&A session with a comment that I want to applaud your group for developing instruments. I think administering these instruments can actually be very helpful for the families and the kids to be able to express their situation, for the kids in particular, and for the parents oftentimes to learn what the kids are going through. It's been really helpful. And just by posing the questions, I think the parents oftentimes know more what to look for, and they become more observant. So it is this kind of iterative process in using these instruments. I think there are some benefits to them in addition to being measurement tools.
Thank you. And let me just, that triggered a thought, and I failed to mention it when towards the end of this session, when I talked about the consensus statement that was for audiologists and all, there is an aligned document that came out of that conference for parents and families. So if any family member wants to email me, I did not put the link up for that. I can either send the document to you or send you a link for it.
Thank you. And I don't know if maybe you can put that in the chat to everybody.